Community Review Board for the OHSU Legacy Transaction Review. I'm Rhonda Zaycox with Insight for Action, and I'm facilitating these meetings. Next slide, please. Quick reminder about meeting logistics. This is a public meeting, so it's being recorded, and after the meeting, the recording will be uploaded to the Oregon Health Authority's website. Closed captioning is available. And for Community Review Board members, if you would like to make a comment or question, please click the react button, then select raise hand or raise your physical hand. And please remain muted until it's time to speak. Next slide, please. The Community Review Board members will discuss the transaction during this meeting, and members of the public can submit comments about the proposed transaction anytime using any of these options listed here. I believe Oregon Health Authority staff is putting the email and comment form and voicemail number into the chat for reference. Next slide, please. Just a reminder about the chat feature. Only the host and co-host can see chat messages. For Community Review Board members, if you are experiencing any technical difficulties, please send a chat message to Lauren Neely. For members of the public, please use those three options that we just shared in terms of sharing your public comments. Next slide, please. Our goal today is to begin discussing concerns and opportunities of the proposed OHSU legacy transaction and begin working towards a recommendation to Oregon Health Authority. We'll do a quick round of brief introductions and highlight our group agreements. Then we will debrief the public hearing, what we learned or heard from that hearing. We will then have more of a general discussion where the Community Review Board members will share what they are seeing as some potential impacts, concerns, and opportunities for the proposed transaction. Then Oregon Health Authority will highlight the recommendation framework and the criteria that we are using to guide the recommendation and start discussing some of those criteria working towards a recommendation. And then we'll highlight the agenda for the next meeting. We will take a 5-minute break as we normally do around 3 o'clock. Next slide, please. All right, I now invite each Community Review Board member to come off camera, to share their name, and to share up to 5 words at the most that describes your current or most recent occupation. So if you're currently employed, just say that occupation. If you're retired, just state the occupation you had before you retired. So I'll start and model. So I'm Rhonda Zaycox, and I'm a facilitator. I believe Wendy Martin will be joining us a little bit later. So Teresa, how about if we go next to you?
Sure, Dr. Teresa Goodell. I'm a retired registered nurse.
Thank you, Teresa. Perfect introduction. Leslie.
Good afternoon. I'm Leslie Foran, and I'm a community advocate.
Thank you, Leslie. Latoria, are you with us here? All right, we'll come back to Latoria when she's able to join us. Joe.
I'm Joe Schnabel, and I am a retired pharmacist, most recently with the Oregon Board of Pharmacy.
Thank you, Joe. Good to see you. Joanna. Joanna, are you with us?
She's on mute.
Oh, okay. Joanna, if you,
sorry, yes, I'm unmuted. Sorry, I'm dealing with traveling again. So, yes, so I'm retired. I'm a former higher education administrator, and before that, I was a faculty member.
Thank you, Joanna. Good to see you. Jerry, I see you're with us here.
Yeah, hi, Jerry Dolness. I'm a business development manager.
Thank you, Jerry. And Howard.
Oh, hi. Can you hear me okay?
Yes.
I've got my headphones on. We have a place outside of Laramie, Wyoming, which is where I am.
Oh.
I'm Howard Cohen. I'm retired. I was a practicing neonatologist many years in Illinois, and then most recently for the last 20 years in Oregon before I retired.
Thank you, Howard. Good to see you. Next slide, please.
Thanks.
As a reminder, these are the 8 group agreements that we agreed upon during our first meeting. I just appreciate how well we are following these agreements. Thank you. Next slide, please. Okay, let's take a moment to remind us where we've been and where we are headed. Next slide, please. In the first 3 meetings, the Community Review Board heard a high-level overview of OHSU and Legacy, saw some comparisons of the 2 entities, learned about the proposed transaction, saw entity statements, learned about the research regarding consolidation in healthcare, and created questions for the entities to answer at the public hearing. Next slide, please. During the public hearing, which was held on March 5th, Oregon Health Authority presented briefly about the Healthcare Market Oversight Program. OHSU presented briefly about the proposed transaction in partnership with Legacy. OHSU and Legacy representatives answered questions from the Community Review Board, and the Community Review Board members listened to public comments. Following the public hearing, we had a short meeting where the Community Review Board decided not to hold a second public hearing. Next slide, please. After the public hearing, Oregon Health Authority sent the list of remaining questions to OHSU to provide written responses. OHSU responded on March 14th of this year with a certified public written responses, and Oregon Health Authority posted the responses on the website. Next slide, please. So, and I'm seeing in the chat that the link to those written responses is in the chat. Thank you, Lauren. So, what happens next? Well, as we said, today we are discussing the potential impacts, concerns, opportunities of the proposed transaction. And the Community Review Board will work towards a recommendation by assessing the transaction against the Healthcare Market Oversight Criteria Framework. When the Community Review Board has made a recommendation, Oregon Health Authority will draft a recommendation report. The Community Review Board will then review and edit the recommendation report, and the Community Review Board will come together to approve the recommendation report. Next slide, please. So this is our proposed timeline, but we are flexible to ensure that we have ample time to discuss and reflect upon the proposed transaction and make a recommendation that we hope will be consensus-based. So today I've already shared what we will be doing. Next week on March 24th, we'll continue developing the recommendation by going through the criteria. Then on April 7th, the Community Review Board will review a draft recommendation report and, if ready, approve the recommendation. We have March 31st reserved on our calendars, and we will use the time on March 31st if the Community Review Board needs more time to really synthesize and understand the proposed transaction and make the recommendation based on that. Okay, so we will kind of have a sense after this meeting whether March 31st is a meeting that we want to use. Okay. All right, I just want to pause there for a moment and ask any of the Community Review Board members, is there any clarifying questions that you have at this point? Okay, not seeing any hands. Okay. Next slide, please. All right. I just want to acknowledge that this meeting is going to be a little bit of a shift from our previous 3 meetings and the public hearing. In those previous meetings and the public hearing, Oregon Health Authority and the entities were sharing a lot of information with you. We are now shifting to the next sets of meetings where really it's going to be the community review board members dialoguing, sharing, learning from each other. And the purpose of these discussions is to help the community review board to make a recommendation about the transaction. Oregon Health Authority staff and myself are taking notes, and of course, there's a recording what is being said to ensure that we are capturing your observations and perspectives. We are now going to have that 2-part discussion where first we'll just debrief what we learned or heard from the public hearing. And after that, we'll have a general discussion about the potential impacts, opportunities, and concerns about the proposed transaction. Next slide, please. So, what did you hear or learn from the public hearing and from the written responses afterwards that impacts your thinking regarding the proposed transaction? I'm going to invite a brave soul of the Community Review Board to first share their observations to this question, and then I'll make sure that all Community Review Board members have an opportunity to share. Again, feel free to raise the Zoom icon hand, and I'll call folks in order. Melissa or Lauren, I'd appreciate if you could insert this question into chat. And then, Melissa, if we could stop sharing the screen and so people can just look at each other as we have this conversation. Thank you. So the question will be put into chat. And again, what did you hear or learn from the public hearing that impacts your thinking regarding the proposed transaction? Who would like to go first and share? Oh, Joanna, thank you so much. And then Joe, really appreciate it. Go ahead, Joanna. And you are on mute, so thank you for.
Sorry, it's
No
the bane
worries.
of my life. I think what I learned partly was there's been a lot of work done by both Legacy and OHSU towards reaching this proposal, acquisition, whatever. Both sides are agreed on it, and the consequences of not doing it are likely to be pretty negative on both entities. So I'll just throw that out there as a start. I can't hear you.
I was on mute. My turn. Turn it off. Joanna, is there anything else you want to share at the moment? That's good.
No, I guess I don't know whether we want to even discuss it, but I was a little concerned about the public comment piece that obviously the PETA animal rights groups had got together and was, every single one of them, that was what they brought up, which I didn't think was actually within our purview because we haven't asked OHSU about the research center. We don't know anything about it. I don't feel like it's something that we should be considering unless we're going to do a lot more work on it.
Thank you. So what I heard you say, Joanna, is that you're observing there's a lot of work that's been done by OHSU and Legacy. Both sides agreed there's some consequences on both entities that if it doesn't go through, and that you just observed that there was a lot of public comments around the research lab, animal research lab, and just unsure if that's part of your preview. Thank you. Joe, I know you had your hand up, but would you like to go next, please? I
prematurely took it down, sorry. But I
please.
Could still weigh in just a little bit. And I agree with Joanna about the amount of work that has gone into this. It was pretty obvious that the amount of planning and background that went into it was tremendous. And the answers to the questions I thought were pretty forthright. They were obviously kind of written out and thought about in advance, but that's, good reasons to do that kind of thing. I I know that there's a lot of questions that even they have, but they seem to have done a pretty good job of trying to be forward looking and try to highlight obviously the benefits of the merger. And I don't think we heard a lot about the kind of the downsides, which I think we've all got some concerns about, but I think that was the main thing. There was one other thing and I can't think of it right now, but I'll come back with it.
Yeah, please, after everybody's had an opportunity, please come back and share. And so thank you, Joe. And what I hear, you're agreeing with Joanna, that there seems to be a lot of work and planning. The answers were forthright and they seem to be working, looking forward and highlighting the benefits. And we didn't hear a lot about the downsides.
And there is one other thing actually that may have been the one I was thinking of. Things have changed since the beginning of this process. And so I didn't hear a lot about how the changes in the financial conditions of both of those entities has maybe changed the planning process for this merger. So,
and Joe, what conditions are you speaking to?
The financial conditions of both of the entities appears to be a little different. I think OHSU may not be in quite the same positive condition that they were in, and Legacy may be in a little bit better condition than they were at, kind of at the outset of this planning process.
Great. Thank you, Joe. Teresa, please.
There, I got it. I came away with some concerns still about quality of care. The metrics that they have developed are mostly, but not entirely developed. And I got the feeling that there was no plan for how they will go about achieving those outcomes. It's one thing to set an outcome. It's a very different thing to actually achieve it. And I did not hear one single thing about how that will happen. I understand that the two entities are not yet combined and that will probably change things, but I had hoped to hear at least some sketch of how they will proceed to achieve these goals that they're setting, which are fairly ambitious. The other thing that keeps coming back to me is that when we asked the Legacy, I believe she was a Legacy vice president, what will Legacy do if this deal does not go through? The answers were things that they could have already done, like asking for better Medicaid funding and leasing or selling off unused properties. I was concerned that they hadn't already pursued those solutions. And a lot of other things that I heard were kind of the same stuff we've read already. I didn't feel like there was quite enough meat, if you will, to the answers.
Teresa, anything else you would like to share at this moment? Good. Okay. Teresa, well, thank you. What I heard you say is there were some, concerns just about quality of care. How are they going to meet those metrics? They're ambitious, and you didn't get as much detail perhaps as you would have liked around that. The other thing you observed is around Legacy's response if the deal doesn't go through. It seems like some of those things are things that they could have already been doing now. So you're curious about that. And I also heard you say, what they shared, you feel like you already read or had information about, and you might have preferred a little bit more meat, more detail. Okay. Thanks, Teresa. Jerry, please.
Thanks, Rhonda. Listening to the comments, looking at all of the write-ups that everyone did, I don't see them hitting a lot of the metrics or the expectations of what the statute and the rules state as far as the equity and the outreach. And I was reading like one of the comments from the OHSU Legacy about how they did the outreach when COVID came out, and they were, giving the shots down at the convention center. And like, these are the things that I was hoping that both both, OHSU and Legacy should have been doing all along. But then I also step back and go, one's a research teaching hospital. That's really not sort of their expectations from us. And so, I look at it from a community health center model, and it's like you're reaching out to the community and doing the things and hitting those metrics that they're sort of funded and expected to do. And I don't know if I expect that from a hospital kind of clinic organization. But the other side of me looks at that and says, I'm reading the responses saying, well, once we get the approval, we're going to do all these wonderful things. And I'm like, I don't know if I have that much faith. And then if I do give that approval or we move forward and then we do a 1 or 2 year look back, what happens if you didn't make it? Do I say, okay, we're going to take everything back and you're all going to go back to where you were before? And you can't do that. And so, I would say, keep doing your homework and keep doing this community outreach stuff that you're not doing that we'd like to see because it's in the legislation that was put in 2022. So that's kind of my overall comments from it.
Thank you, Jerry. Is there anything else you want to share?
Not at the moment.
Well, Jerry, what I'm hearing you saying is a little similar to what I heard Teresa say. Sounds like you're concerned about a little bit about the metrics, but more about the criteria for the Oregon statute, specifically around access and community engagement. I also heard you're a little concerned about if the approval goes forward and there's a 2 year look back, and those things did not happen that they said they were going to do, what's going to happen then?
Correct.
Is that fair?
Yep.
Okay. I see Howard, please.
Let me put my hand down, I guess. First of all, I appreciate everybody else's comments. It's very helpful for me because I've been listening to a lot, of course, from the public hearing and also reading a tremendous number of public comments as well as OHSU legacy comments. And it's apparent that from their comments that at least they feel like, and they probably have done a lot of work on this acquisition. They do have some concerns, at least if it doesn't go through in their minds. I have my own view on whether their concerns are necessarily all that valid in terms of alternative solutions that could happen if it doesn't go through. I've read a lot of the public comments about review. For example, if we approved with certain conditions, why that couldn't be a condition that we recommend as a community review board. I'd be interested in hearing, I think, what Joanna said about what more work we would have to do to be able to kind of comment on that. I feel like that's certainly part of OHSU and would be part of the post-transaction organization. So it feels like we could make comments about that. I'm also concerned, as Teresa was, about the metrics, and both in terms of the very general and a little on non-specific. And I read through the metrics again that they've published several times. I don't see a metric, for example, that touches the area of patient or family experience. There's not a metric related set to what people generally survey, patient satisfaction, which I call patient experience, how patients experience the care. They don't have a metric for that or a parent goal, which I think is important. And I share some of Jerry's concerns about what happens 2 years down the road. At least my understanding is that OHSU has once this goes through, there's really not going to be any going back. They have an antitrust protection from the state. And once there's a once the acquisition happens, it can't unhappen. It's kind of what's happening nationally. Once things are closed, you can't reopen them and expect things to kind of go back to where they were.
How are you? Good for the moment? Okay. Well, Howard, thank you. Just again, want to lift up what I'm hearing. I heard you agree with many of the other community review board members that, wow, they've done a lot of work. Both of these entities have put a lot of effort into it. I heard that you're unsure about their concerns of it not going through. Would those be as bad perhaps as the entities are sharing? I also heard you say that with the animal research lab, that might be in our purview, and that could be a condition, to discuss. I also heard you talk about the metrics, as some other folks have already highlighted, a little concern about that there wasn't as much information as you would like about how they will achieve those metrics. You also saw that there might be some gaps in important metrics like patient and family experience. And similar to some what other members have brought up, you are a little concerned about down the road, after 2 years, if things are not going in the way that was the expectation, there's not a lot of leverage on making those shifts. Did I capture that, Howard? Okay. Okay, great. Leslie,
Yes,
please.
thank you.
Leslie, please.
Hi, everyone. Again, I really appreciate everyone's comments as well. It's helpful just to hear and validate some of the same concerns that I have. I think the biggest ones for me coming out of the public hearing were around the metrics, just as everyone has explained, and same concerns. I was looking for more data-informed decisions. Specifically hearing from Zachary a few meetings ago where he shared some data about other mergers and acquisitions. I feel that there's great intent and there's been a lot of work put into it, but I'm not seeing the data to inform this decision that this is the right decision for them to come together. Same concerns around the financials. I think it was Joe kind of saying OHSU is in a different place today, and Legacy, specifically around some of the public comments that was a concern during the meeting and then validated for me in the written public comments around executive orders coming down to academic institutions about care for trans patients, and how Oregon, people may be coming to our state to receive care, and what could that have an impact on patients? I'm still unclear and a little bit conflicted. And again, this may be homework that I need to do, but I'm still unclear on the staffing impact from the public comments that I read. The unions, we had somebody from the Oregon Nurses Association, unclear of that impact between the union and non-union employees. And given what has happened in the last several weeks with layoffs, how could that impact? I know they've made some commitments to not do workforce reductions, but I'm just unclear on that impact to both sides of employees in the transaction. And then the last thing I'll say, and this was in their written response about the impact from a payer perspective and insurance. I think their comments was something like, we'll work in good faith and, negotiate contracts. But I think that's a critical part for people who do have insurance to understand what that means for their network and who their provider will or won't be, or where they will be able to get care. So that's still unclear for me. And I think that's it.
Wow. Thank you, Leslie, for sharing your perspectives. And again, as you already highlighted, some are similar to what we've heard with other community review board members, and you highlighted some additional ones. What I did hear you say is, like many of your members, that there's great intent here. There's a lot of work that these entities have put together. So I'm hearing that from you, but I also heard some concerns, like we said, that others have mentioned, just concern about how well the entities will be able to actually meet the metrics. Also, you were just hoping that there would have been some more data that they could have shared that they used to inform their decision of why is this the best option at this point in time, is what I believe I heard you say. You are also a little concerned about the changes in financial conditions for the entities, as well as what I think I heard you say, the changes of the environment, especially from the federal changes that are going on right now. You're unclear about staffing impact, specifically on union and non-unions and with recent layoffs. A last thing I heard you had a concern about is just the insurers, payers, that there will be negotiating contracts, but unsure how might that impact patients' access and choice of who they see. Did I capture your themes?
Yes, thank you.
Okay. Wow, what great observations. And I love that there's some similarities and some uniqueness. And as I heard one of you say, it's helpful to learn and hear from each other to help inform your individual perspectives. I just want to pause and I want to ask, is Latoria with us? I'm not seeing you, but I just want to make sure I'm not missing you. Okay.
Rhonda, she did join.
Okay.
Oh, yes. Hi.
Oh, Latoria,
Hello.
wonderful. Hi, they have a big screen with a lot of names. So, Latoria, thank you for joining.
No, thank you.
So, Latoria, if you would be, I'm not exactly sure when you joined, but I think you probably are hearing, we're debriefing from the public hearing. And so if you can share your perspectives around that, that would be wonderful.
Okay. I have a lot of the same. I heard a few ones, and I have a lot of the same hesitations, questions, but it was a lot of information, and they did do well. I did appreciate everything, but yes, more time would be good to think about this, to make sure we get all the information correct.
Latoria, is there any specific comments or observations that you want to underscore at this time?
No, not at this time. What was mentioned, really, I appreciated Jerry and Howard. I appreciated both of their comments.
Okay.
I really, yeah.
Okay, wonderful. So what I'm hearing is that you're kind of your what other community review board members, especially Howard and Jerry, is really aligned with your perspectives.
Yes.
Okay. Thank you for that.
Thank you.
All right. And then Wendy, have you been able to join us? Lauren, am I missing Wendy?
She hasn't joined yet.
Okay. Well, I know she was planning on coming a little late, and so she will be able to share her perspectives when we have the general conversation. Okay. Melissa, would you be willing to put the slide deck back up? And go to the next slide, please. All right. It's obvious that all of you, the community review board members, were very present and attentive during the public hearing. And again, we're so appreciative that you're sharing what you heard and learned. I'm especially grateful for your ongoing commitment to this process. We are now going to engage in that second part of the discussion, and that's a broader one. And if we can go to the next slide. And this is really the opportunity now for you to share your thinking about the impact the proposed transaction may have in your communities, what opportunities there might be, and what concerns you may have. Now, those might be somewhat similar to what you shared about the public hearing, but this would be the opportunity to dive a little bit deeper, to really even ask each other's questions, so that we really kind of get a sense of what might be the impact, both positive and negative, and what are those opportunities to be considering and those concerns. Again, of course, we are documenting and recording what you're sharing with us. So at the next meeting, we'll be able to bring back and kind of display the themes that we're hearing from you. I also just want to acknowledge there's a lot of information, as you've already shared. These entities have put forth numerous documents. Of course, OHA has had some documents that they've shared. We had the public hearing and, of course, the written testimony. And as many of you have already shared, there's been numerous public comments. So, you may even feel a little overwhelmed with so much information. With that said, what's most important for you is to share your perspective as a community member and whatever you've learned through the documents and public comments. Each of you may have focused on different pieces of information. Some of you may have really dived into the public comments. Some of you have maybe really dived into the entity's transaction report. And so I'm inviting us to help each other distill key points by sharing what we've learned. We can all teach and we can all learn from each other. I think we already are doing that just from the debriefing from the public hearing. So similar to what we just did with the public hearing, I'm going to invite someone to go first and just share their thoughts about these questions. And then again, I'll ensure that every community review board member has an opportunity to share. And we have ample time to do this. I'm looking at the clock. It's about 2:36. We'll probably go for like a half an hour and then we will take a break, but we can come back after that break. So I don't want to feel anyone rushed, but I also know we'd like to move our body and have a little bio break at the top of the hour. Okay? Howard, thank you. Will you please start us off?
Okay. I'll jump in. The first question really helps me. First of all, I'm not in any order of my thoughts about this over the last week or two. It's a little unclear how this transaction is going to improve primary care, how the new entity will attract and maintain primary care physicians, which I think is a big piece of what this should be about, the increasing the ability of people in the community in an equitable, inclusive way to be able to get pretty prompt access to primary care in an ongoing way. It seems like OHSU's primary function is really around tertiary care and quaternary care, and part of what seems to be driving this for them is the ability to kind of open up beds so they can bring more patients in for that type of care. And at least also reading some of the written comments that have been submitted, that seems to be more of their focus. And they've struggled a little bit more with the primary care aspects, which they'll be responsible for. I'm concerned, even though I don't think it's in our purview necessarily, about what this is going to do to the price of care, particularly on the commercial side. And if the commercial prices go up, that has an impact on what we pay for premiums. They'll increase. That's how it gets passed along, and it won't just be an impact on the healthcare providers, but on the healthcare system, but also other people who live in the community, particularly those who have commercial insurance. And it's a little unclear to me, before I stop talking about how this is going to work related to Medicaid patients. Whether Medicaid patients actually have more trouble getting care. I think they probably do. But a lot of patients that are Medicaid get their care at Legacy hospitals now. And how is that going to change based on this? And the Medicaid patients is obviously pay less than the commercial insurance pays. I'd like to maybe hear more from them or talk more about the Medicaid population and how it's going to work for them in a different way. And I'll just stop there. So
Okay, Howard, thank you. And again, people can come back and share other ideas after everyone's had an opportunity. So Howard, I think I was hearing three concerns or areas where you're just unsure about. And one was just about how this transaction will improve primary care, especially recruiting primary care providers to ensure equitable, inclusive, and prompt access. Second thing I heard you is just you're unsure how it will affect price of care, especially for commercial side, and maybe will affect the premium price. And then the third, I think I heard you say was how it will affect Medicaid patients, especially access, given that Legacy has been a primary provider of Medicaid. Did I get that? Thanks. All right, Joanna, please.
Sorry.
No worries.
I'm trying to get my video on. So I guess I maybe would like to be a little positive on this. The fact that they've done a lot of work. They both sides are positive that there will be good things coming out of this, and I'm concerned that we don't go down the hole of there's all these things we don't know about, so we need to say no, versus we're supportive, but we would like to see these recommendations included in what we say to OHA. I will say for OHSU in Klamath Falls, OHSU has a rural residency program in Klamath Falls. They're the ones that are down there, not Legacy. And they're training doctors in rural areas. It's pretty successful. They've got a group of residents that come in, they run them through. So I think that's a positive that demonstrates, yes, they do care about rural communities. They do care about other than Portland, which I think we need to also think about. It's not only Portland. The other thing is that I have heard, I think there's a lot of opportunity in this issue of capacity, physical capacity. The fact that Legacy has empty operating rooms and has inability to fill areas, whereas OHSU is stacked up and cannot see everybody. And, they are sort of the place for specialty care, tertiary, quaternary. And I think it's pretty critical that Oregon has the ability to treat people who need the specialized care. It's not as easy as the other, primary care. Yeah, you need to find a provider. I get that. But you also need somebody that's going to be able to see the person, with breast cancer that's, metastasized, and where are they going to go? And I know someone that's been waiting a year to try and get into OHSU and is having to go out of state because there's such a backup to get in and get the care in Oregon, which I think is a pretty sad reflection on where we are now. So I guess I will put it out there at this point. I'm leaning towards supporting it. I know I'm jumping the gun a little bit, but I'm hearing so much negativity. I kind of feel like I need to do something on the other side a little bit to just say, I think there's a lot of benefit to this. I absolutely agree. There are questions that have not been answered that I think OHA needs to pursue in order to approve it. But I think that there's a lot of good that can come out of this.
Thank you, Joanna. Are you done?
I'm done. Thank you.
Well, Joanna, thank you. This is why we have a community review board with people with different perspectives, and sharing those perspectives is so important. So thank you for doing that. And, what I'm really hearing from you is, wow, both sides are very jazzed about the transaction. You're seeing some indications for OHSU really caring about rural communities with the example you gave, and just the really importance of building that physical capacity where Legacy has those empty rooms while OHSU is stacked up, and really having that partnership could allow that tertiary care to happen and have more access to it, and really you're seeing the benefits of this. Did I capture that okay, Joanna? All right, I'm going to assume yes, unless you correct me differently.
Sorry, it automatically muted me again.
Yeah. No,
Yes, no, you
okay. Okay, great. Thank you so much, Joanna. Really appreciate it. Teresa, please.
I would like to speak a little bit about the foundation that will be formed. I've been thinking a lot about that. It has a tremendous potential to improve health equity, at least in the greater Portland area, if not the whole Pacific Northwest, maybe even further afield. $600 million is a lot of money, and it could, if done right, have a tremendous impact. My concern about it is that the way it's currently being described is sort of the same old, same old. The board members are chosen from existing legacy board members on their foundation and their overall board of directors. And that is not the way to go about achieving health equity. You have to involve community members, people from the community that you are trying to help. People from underserved communities have to be there from the very start. So if they're going about it from a top-down fashion, it will not succeed. And that really concerns me. Although, again, opportunity there is tremendous if they do it right, if they change their current plans. So I'm concerned about the composition of that board and they're quite vague plans for including members of the community. There was nothing in there about how many members, how they will recruit people, or on what timeline. That concerns me. Speaking of board members, OHSU would take over Legacy's board seat on Oregon Health Share, which administers the Oregon Health Program, Oregon Health Plan. And that concerns me as well. I think the main opportunity there is for OHSU. And I don't think that that serves the people of Oregon very well to have double representation of what would be very, very large health system. So that concerns me. And I also have kind of a personal story. I was talking with my neighbor who has a 2-year-old daughter. Her daughter gets care at Randall Children's, and she's concerned about whether or not they'll still be in network should this transaction go through, as has been mentioned before by other CRB members. What will happen to those patients? That's a question we haven't had an answer to yet. That's all.
All right. Well, Teresa, thank you so much. And I heard you see some opportunities and concerns around the foundation, that you see this as a wonderful opportunity, given the amount of resources to really make some significant impact around health equity, but you're concerned about the structure of the board and how will community representation, especially those maybe most impacted, are going to be able to influence the strategy, the direction of that board. And I also heard you, as we've heard before, another community review board member, just concerns about payers and insurance and that access that may change and what might that look like. And then the third concern I heard you say was about the Oregon Health Board that oversees the Oregon Health Plan, and that OHSU may have double representation. That concerns you a little bit. Did I get that? God, thank you. Okay, Joe, please.
Well, I appreciated Teresa's comments about the foundation. I was too a little bit unclear about how they were going to represent the community viewpoints. And I also appreciated Joanna's little rays of sunshine, because it is easier to shoot things down than it is to actually build something. So I think we've all got both sides of the equation there for sure. I think opportunities include kind of clarifying the metrics. Most of them haven't been fully built out, and Howard's comments about some of them not really being necessarily patient and family experience oriented, there might be an opportunity to kind of refine those metrics and then have some sort of reporting mechanism after, if this does go forward, that there is some accountability towards achieving those metrics. I think the synergies between Legacy and OHSU, I think they've done a good job in trying to elucidate and explain those, and they do make sense, at least just from a quick observation of those. One of my concerns is the kind of glaring lack of equity between the unionized employees and the non-represented employees in terms of their job protections. And it seems that there is a very large gap between those two groups of employees, and I don't understand how that really can be justified. And then my other major concern is really just market consolidation and the impact that that's going to have on costs and choice going forward, and the fact that it can't be undone once it's done. And that's all I've got.
No, thank you. Yeah, we're starting to hear some themes, right? And I was hearing the theme similar to what Teresa shared about the foundation, seeing it as a great opportunity and some concern about the community representation. I also heard you see really the positive synergy between OHSU and Legacy of how they potentially could partner in a good way. I heard some of your concerns are similar to the metrics that we talked, I think, earlier, a lot in the public hearing discussion. Just there may be some missing ones, unsure how those will be met, and what is the reporting mechanism and the accountability around those metrics. You're just kind of unsure about that. And then you have some concerns or uncertainty around the difference in agreements between union and non-union employees. And it seems like there's a gap there that you don't really understand why. And of course, the last thing is just the impact of market consolidation on choice and cost. Pretty much capture what your key concerns, opportunities.
Yes, thank you very much.
Thank you. All right, Jerry, please.
I might be the Debbie Downer here, but or making people say ouch. But I from everything that I've heard from the testimony, and to me, and my cynical view of it is it's going to be sort of just status quo and things will be the same. Because I don't really see that these organizations really have put together a really good plan to say this is what we're going to do this, or to do outreach here, to do this in a different location, or training, education, whatnot. So I think from the opportunities also, it looks like the opportunities there are for Legacy and for OHSU. I don't see as much opportunity for the community and for the state who would be possibly affected by this. Because now you get an organization that has the ability to get better bond funding, and so then they can go and get their $1 billion or whatever they were talking about to upgrade and make the facilities and do the things they want to do with that money. The 038 review board is dealing with the foundation piece, so I really don't want to touch on that per se, but there's that. And then, part of me thinks this is a good first step for the OHSU Legacy potential acquisition, for them to understand that you could get the answer of no, but now you have to go back and do your homework and address the issues that we brought up. And then you have the chance to come back in a year or two and say, okay, now we have a plan in place, and this may be something that's acceptable to the next review board after you said no the first time. So go home, do your homework. It's kind of like defending your dissertation. Got to do a little bit more work. But so that's kind of where my concerns are as far as that is. I'm concerned about no improvement or any change for the better for the community. And then, how do we go back and fix that?
Jerry, anything else you would like to share?
No.
Okay. So Jerry, I heard you say a couple of concerns. I think the overarching concern is what I'm hearing you is that it may just be the status quo, that all of the goals may not materialize because what I heard you say, you don't think there's a really good plan in place to address, to move forward some of those goals. You're concerned that the opportunities may be good for Legacy and OHSU, but you're unsure if it will be good for the citizens of Oregon in all. And that, if this was a no, that could be an impetus for the two entities to come back with a very more specific, targeted, strategic plan that would maybe answer some of the questions. Is that fair?
Yes.
Summary?
Yep. Thank you.
Yeah. Okay. Thanks, Jerry. Leslie, please.
Thanks, Rhonda. I think some things have already been covered by others, but one that is really talks and speaks to me about the impact on the community is, and one point that's really important to me that I saw in the written comments was there were many nonprofits and organizations or professional associations that were in support of this. Planned Parenthood, Apano, I think ONA, a couple others saying that this would be beneficial to the community to have further reach, to have better care, to have integration, which I think is really great. I also felt that the impact to OHSU was seen in a more positive light. Their interim president spoke during the public comment. There is the director of health equity from OHSU who submitted public comment in support of this, but I'm not seeing that impact on the legacy side. I think there may have been one or two written comments about from a certain portion of the staffing from legacy. So that is I would love to see more of that true impact on the community and that grassroots kind of reaching where the people are and where they're accessing services, because I think there is some favorable. One of the other concerns is that on a lot of the written public comment, those that are in opposition don't sign their name or don't have an affiliation, which to me leaves unknown of what that impact is to that. Is that to an individual community member or are they part of a group? So I think that's just, I'm concerned about really truly what is that impact to the community. We talk about health equity and involving all groups when we make decisions. That's something that stood out to me. And I think the only other thing I'll say is that I'll echo what Joanna says. We won't know everything. We may never have all of the information, and that there may be stakeholders that aren't happy either way, whether it's a yes recommendation or a no recommendation. So I think hearing from all of the members is really critical to just recognize that there's a lot of stakeholders in this transaction, and that can be an opportunity and a concern at the same time.
Leslie, is there anything else you would like to share? Okay, Leslie, thank you so much for really sharing your observations from the public comments. And what stood out to me, what you shared, is that you saw there was a lot of support from nonprofits. There was also from the public comments a lot of support for how OHSU is doing engagement and doing outreach. You saw less perhaps comments or support for Legacy's engagement from the public comments. You thought it was interesting among those that were doing opposition, many didn't sign their name or affiliation. So it's just unclear, how's this going to impact those communities. And, just again, what you said, echoing Joanna, that we'll never maybe have all the information we need. There's a lot of stakeholders. And so it can be hard to really discern the best course of action. Is that fair, or anything else you want to add?
I think that's good. I just want to make one clarification on from a sense of support or the impact. I think there's favorability from the comments and the written documents are coming from OHSU leadership saying
Leadership.
that this would be beneficial. And like I said, the interim president speaking at the last hearing, and then there's some letters of support from a director of health equity. So that I just want to make clear. It's OHSU.
Thank you. I really do appreciate, because I think I did misrepresent what you said there, that you were saying that there is a lot of public comments from OHSU leadership and other entities or people within OHSU, and you were just observing that. Thank you for that clarification. Appreciate it. Okay, I see it's about 3:01, and we've been really having very robust discussions, and I'm recognizing that we still have two members who we would love an opportunity to hear from, Latoria and Wendy, if you've joined us. But I'm going to suggest we do take a 5-minute break now, and then we will come back and invite Latoria and Wendy to share their observations, and then we'll move on. So my clock, I think it's going to move to 3:02. So how about if we come back at 3:06? All right, so we'll see folks back at 3:06. Short stretch break. I just would appreciate, thank you. I just want to make sure that our community review board members, okay, Leslie, I see you. Thank you. Jerry, I see you. Joe, I see you. Joanna, I see you there. And Howard. Latoria, if you're with us, you want to turn on your screen or raise your hand. And Teresa, I see you. And Wendy, you could let us know you're with us.
Yes, hi.
Oh, hey, Wendy. So good to see you. Thank you for joining. I know you had a conflict with the earlier part of the meeting. What I'm going to request is, Melissa, can you go back to the slide before the 5-minute break? Thank you. So just a reminder, we had a very robust discussion with the community review board members where they were sharing their observations, their reactions to these 3 questions here in terms of what are we hearing, learning, knowing about the transaction's impact in your communities, what opportunities might there be, and what concerns you may have. Wendy and Latoria, you were the two that didn't have an opportunity to share before the break. So I would like to offer the opportunity for you to share your observations. And so Wendy or Latoria, if you want to raise your hand and just go off mic and share with us, that would be lovely.
Rhonda, Latoya had to drop off, just FYI.
Oh, she did. Okay. So Wendy, would you be willing to come off mic and share some observations to these prompts?
Yeah, absolutely. So I think after the public comments, one of my questions was really about the scope of this this project, and I think it would be good for me, and I apologize if I missed conversation on this earlier, to hear if we are to be looking at the components of each system, such as the primate center, majority of the comment time was spent on that. That's, of course, there's a media component to that piece as well that's hard to not see if you're in Portland. I'm curious if that's really what we're here to do. I don't disagree with anything that I've heard, but I also don't know that we're the ones with the expertise to know, what the right thing within each health system is for running their businesses. As far as what I've heard, learned, and know about the impact on healthcare for humans, the people side of this, I think there's a lot of information there. There's a lot to digest. I think on paper and from what we've heard from the two systems, they both think that this is positive. I do have some concerns. Some of what I've heard from the folks on the group health plans that I administer, and that's really where a lot of feedback comes, as well as my own personal experience, has to do with the gatekeeper. And especially at OHSU, there is, scheduling goes through a central office, and referrals are being denied even within specialty care. And that's a common challenge now for people to find new providers. Is this going to make that worse? Will there now just be one system and one set of rules and one gatekeeper and one massive hurdle to get past to get to any providers? So that's, that is a concern. The staffing challenges, I'm not 100% sure where the staffing challenges are solved by this. Again, OHSU seems to have less problem maybe than Legacy in their staffing from what we've heard. But if OHSU's teams were trying to staff Legacy's positions, would they be pulling from a different pool of candidates? Would they be paying a different pay rate? What would truly be the difference that they would be able to do to get those positions staffed? So those are some of just coming in sort of towards the midpoint of this meeting, the items that I have noted that I still have questions and concerns about.
Well, thank you, Wendy, for just jumping in, and I will just share what I heard you say and where I see, some similarities of what others have been saying as well, since you did not get to hear from your colleagues. What I heard you say was, that there's a lot of information that's been shared, and both systems think it's a positive transaction. And other colleagues, other community review board members have shared that similar observation as well. More on the concerns or the uncertain side, I heard you just unsure about what is this community review board's role in the preview with the Animal Primate Center, given the public comments and the media campaign, and other community review board members raised that, like just unsure. And another community review board member thought maybe it is in our preview, but it sounds like several of you are kind of unsure about that. What I heard you also say was around staffing. How will this kind of solve that challenge? And it's just unsure how this transaction will do it. And also another thing that you brought up that I don't think we've heard is really about this gatekeeping, about a central office really is the one that gatekeeps access to care and appointments. And you're just unsure how this transaction will create better access around that. Did I mostly capture the things I heard from you?
Yep.
Okay, great, thank you. All right, before we move on, did anybody else want to share any other observation that you may have had after hearing somebody else or having our 5-minute break? I'll open it up just for anyone else to make any other general observations around these prompts. Again, thank you for your very thoughtful questions and thoughtful observations around this transaction. Let's move to the next slide, please, Melissa. Okay. So what we're going to do now is just spend a couple of minutes where Zachary from Oregon Health Authority is going to remind us about the recommendation framework, that criteria. I think, Jerry, you were already referencing it, that we hope will inform your recommendation process. So next slide, please. And Zachary, will you take it from here?
Great. Thanks so much, Rhonda. So hi, everyone. Great discussion so far. So let me kind of re-ground us a bit in terms of what informs the Oregon Health Authority's decision. And then we're going to go to the criteria that we'll talk about in a bit. So first and foremost, there are multiple things that filter into the Oregon Health Authority's ultimate decision. One is public comment. Many of you have mentioned that you all have been reading those public comments. Anytime we get a public comment, we post it so everyone can read it So that's a big input. The second is the information from the entities. So this includes the initial filing, as well as any subsequent information. The public hearing is one example. The written responses after the hearing is another example. Oregon Health Authority also receives confidential information from the entities that's not published, and that also goes into the decision. Thirdly is your recommendation, the community review board discussions and your ultimate recommendation. And lastly, any other agency and publicly available data, reports, analyses that are published. So all of these things kind of filter into OHA's ultimate decision. Let's go to the next slide, please, and let's talk about the criteria for a moment. So we've covered this before, but I want to cover it again just to kind of reorient us. So these are the statutory and regulatory approval criteria for the Healthcare Market Oversight Program for a comprehensive review, which is what we're doing now in this transaction. So on the left-hand side, we have a number of criteria, and it has to meet those and either B or C. So it has to meet A and B or C. So on the left side, there's no substantial likelihood that the transaction would have material anti-competitive effects not outweighed by benefits in increasing or maintaining services to underserved populations. No substantial likelihood that the transaction would be contrary to law, that it wouldn't jeopardize the financial stability of a healthcare entity involved in the transaction, or it wouldn't otherwise be hazardous or prejudicial to consumers in the public, or the public. So it has to meet those and either B or C. B reads, the transaction will benefit the public good and communities by reducing the growth in inpatient costs or maintaining sustainable cost growth. So that's kind of the cost area. Secondly, increasing access to services in medically underserved areas. So that's the access area. Or rectifying historical and contemporary factors contributing to a lack of health equity or access to services. So that's that equity area. The transaction would improve health outcomes for residents of the state. That relates to quality on some level, but it's worded slightly differently. So these are the overall regulatory, statutory criteria for the program. Let's go to the next slide. And we've talked about this before too. Given all the information that you have available to you, the specific ask is for the CRB to consider mainly that latter criteria in A, otherwise be hazardous or prejudicial to consumers, as well as the entire right side. Now, if you have thoughts, recommendations about any of these criteria, we welcome that. I want to be really clear about that. Given that some of these criteria are kind of more technical in nature, measuring anti-competitive effects, that's kind of a quantitative exercise. So we wanted to highlight the ones that we're particularly interested in receiving your input about, and say, if you have any recommendation about any of these criteria, we welcome that. So these are the ones that we wanted to highlight for you. Any questions? Yeah, Teresa.
I tried hard to fully digest that comment from Brown University, which was really interesting and packed with information. I am certainly not a health economist, but one thing that stuck out to me was they pointed out that the HH index calculation by OHSU as presented in the documents was not accurate because they included Kaiser hospitals in it as a competitor, and also because they did not include Adventist and Hillsborough hospitals as part of OHSU. And when we're thinking then about increasing access to services in medically underserved areas and rectifying historical and contemporary factors, to me, these things just stick together. The notion that perhaps they weren't fully perhaps they did not fully disclose what the market dominance might actually be here in the end, if this transaction is approved. That really concerns me. And I'm wondering if OHA has any comment on that Brown University paper.
Yeah, that's a great question, Teresa. Thanks for that. At this point, I don't want to comment on any particular public comment or other. We take all public comment and it all feeds into our ultimate analysis and decision. I will say that we are also on the OHA side doing all the analysis, the quantitative exercises of calculating market impacts, and we're still in the process of doing that.
Thanks.
Yeah, Howard, go ahead, please.
I don't have a lot to say yet, but I just want to second what Teresa just said about the Brown consultation. That's why I asked to get clarity on whether they were asked to do that consultation or whether they kind of just took that up on their own and pretty much they decided on their own. Although one person on their study group does evidently lives in Oregon, but is a student or a fellow at Brown. But I just also share her concern about the HHI calculation, even though I certainly don't know how to do it myself. But I thought that was an important thing that they pointed out.
Thanks for that, Howard. Yeah, I appreciate that point. Any other questions or thoughts about the criteria? Because where we're going to go from here is Ron is going to continue facilitating all the great discussion that you've already had and continue those discussions and start to kind of frame them into some of these criteria. So that's kind of what we're going. That's where we're going from here. We wanted to be sure that you had a strong foundation of what those criteria are.
Thank you, Zachary, and thank you, Teresa and Howard, for your questions. If we can move to the next slide, please. All right, so we discussed this during our first meeting. So this, again, is just a refresher, a reminder. We agreed that, well, first of all, as you all know, the Community Review Board is charged with recommending one of the following outcomes to Oregon Health Authority. You can choose to approve. You can choose to approve with conditions or choose to disapprove. The approve with conditions, we're not going to go a lot into that right now, but what that generally means is that the review committee could suggest some concepts, some things that you would like to see in the entities if the transaction is approved. And so they can be more like concepts. They don't have to be detailed legalese written statements. Oregon Health Authority would be the one who would do that, but it would be just general requests that the Community Review Board would think would be important to have. Okay, so that's what we're going to be driving towards. And on the right side of the slide is a reminder what we agreed upon during our first meeting together, that we agreed that the board will use a consensus decision-making model. And this means that the board's recommendation must be one that all members can accept, support, live with, or agree not to oppose. That would be the ideal. We also agreed if, despite our best efforts, that we cannot reach a consensus-based recommendation, then the recommendation will go as a majority vote. We also talked about that the majority vote would be described in the recommendation report that OHA would draft. We would also include a minority report in that. But the majority would be the recommendation. We know that the agreement on the recommendation requires that a majority of the Community Review Board members be present a quorum. So we need to have, there's 8 members, so at least 5 would need to be present in making that decision. Just want to remind us of that. That's what we're driving for now. Next slide, please. So again, because just unpacking what we mean by consensus, And that is get to agreements that everyone can support or at least live with. So you don't have to be 100%, but you could be like, okay, I can live with it. We'll have plenty of time for a full and complete discussion. And when we go to make that discussion, remember, we'll kind of do a thumbs up, thumbs down, or thumbs sideways. And if someone does a thumbs down, they would then be asked to give an alternative, a proposal. And if thumbs sideways just means I just need more information, and then hopefully we can educate and share, right, what we understand about with the person who did the thumb sideways. Okay. So just want to check in to see if there's any questions or comments about our decision-making process. Okay. We are not going to move to any decision-making in our time together today. We are continuing to dialogue, discuss, and share our observations. Next slide, please. Around the recommendation criterion that Zachary just shared. We will start by focusing on perhaps one, maybe two of those criteria today. We'll see how far we get. And at the next meeting on March 24th, we will bring back to you kind of a synthesis of what we heard, your reactions about opportunities, concerns, and impact. So you will have kind of a high-level themes around what we heard and whatever themes we heard around the criteria that we were able to focus on today. Then on March 24th, we will continue discussing. There's a total of 5 criteria on that slide. And so we will continue to discuss those. And after we've had time to discuss those, then we'll go to more kind of thumbs down, thumbs up across those criteria, and then to the final approval. Okay. All right. So if we can go to next slide. And the criterion that I would like us to discuss now, and again, these come from the slides that we just saw, is the transaction will benefit the public good by reducing the growth in patient costs or maintaining sustainable cost growth. So what we would love to hear from all of you is, right now, what do you think? And how well may the proposed transaction meet this criterion? And really important, why or why not? So again, I am going to invite everybody to share their perspective on this, and would just appreciate if someone would raise their hand to go first. And this is again about costs. Oh, Howard, thank you.
Am I the volunteer on this one?
Yeah.
I don't think they can.
And why is that?
Whether or not the transaction happens or not, I don't think they're going to be able to reduce the growth in patient costs. They've even admitted that. And again, if you go back to the Brown paper and what the literature says about these kinds of transactions, they increase cost.
Okay, thanks. Howard, anything else you want to say on that?
No.
Good, thank you.
I was brave.
But thank you, Howard, for sharing what you thought, and then kind of why or why not. What was the why under it? Jerry, please.
So they admitted in their statements that costs would go up between, I think, 4.3 and 4.5%. And the OHA statutes, whatever, I think says they try to control cost at 3.4%. So they're already admitting that they're going to be a 1% increase possibly, and that's just probably the minimum. And of course, citing the Brown study, it doesn't look like there's going to be any cost savings. And since CPI, typically inflation is usually going up anyhow, and in healthcare, it tends to go up even higher. I don't see this meeting that criteria for this question about the maintaining the cost of growth. That's it.
Thank you, Jerry. Teresa?
Ditto. I'm thinking exactly what Howard and Jerry said.
Teresa, you complete? Okay, great. Joe?
I don't think I have a lot to add either, other than healthcare economics is different than just a plain market and supply and demand. And there has been some evidence that the fewer the hospitals, the lower the cost in a market. But I think it's always better to have vigorous competition. And when you reduce that and create the largest system in a market by the merger of two other systems, that I don't see how that would be a positive on containing cost growth. So
Joe, I'm hearing you're kind of leaning no. I don't think that.
I just don't think it's going to have a positive impact. I appreciate that they're claiming they're going to do their best and still be about 1% above the target, but I think, like Jerry said, that's probably the minimum.
Okay. Thank you, Joe. Joanna, please.
So I don't think we know enough, and again, particularly in this political, constantly changing environment that we have now, I find it very difficult to be able to say I think something this will or won't. I don't feel informed enough. I would like to see some other studies other than the Brown University study. I think we have some unique things about the two institutions that are not similar to just Hospital A versus Hospital B because of the different mission of OHSU. It's not just another hospital system. It has a whole different perspective in terms of the educational side of it. So I'm very cautious about saying, oh, Brown said this, so therefore this is what we're going to go with. I really would like to see a little bit of other information. And so I think they've said what they think they're going to try and do. I don't know if they'll make it or not, but I don't know that anybody knows enough to know at this point where we'll be in a year. We don't know what's going to happen with Medicaid. We don't know what's going to happen with Medicare. We don't know what's going to happen with a whole lot of things in the health industry.
Okay, thank you, Joanna. What I'm hearing you say is just you don't know, you're unsure, and especially because we have an unknown federal environment at the moment with Medicaid and Medicare, and you pointed out the uniqueness of OHSU and Legacy's. So thank you. Wendy, please.
Yeah, I agree with everything that I've heard here, including there's a lot that we don't know, and more studies could be done, obviously, but I don't know that we'll ever really be able to predict the future. I think the part that I'm hesitant on this is what happens to Legacy if this doesn't happen? And what happens to patient costs within that part of the system? We've heard a story of a pretty dire situation there. How will they staff those beds? How will they continue to serve the community at a reasonable, sustainable cost if this doesn't happen?
Wendy, is there anything else you want to share on that? So
No.
when I'm kind of hearing, you're still unsure. We don't know. It's always hard to predict the future. And your concern is, well, what happens to Legacy if this doesn't happen in terms of the impact on patients? Okay, great. Okay, let's see who haven't. Joanna, go ahead, and then I'm going to see if Leslie I think Leslie, you'd be the last person we haven't heard from. Go ahead, Joanna. I see your hands up. And if you're speaking, you're on mute.
Sorry. Yeah, I'm sorry. I was going to wait for everybody to go, but I did want to agree with Teresa. I think that we do need to look at what's going to happen if we say no. what will happen to legacy? What will happen to costs at legacy? What will happen to care of patients? They've got to do something about their debt. So I think that is part of the conversation. Maybe it's not a perfect idea to do this, but is this better than letting legacy sit out there and continue to go into debt and have to cut? Either they've got to cut things or they're going to have to raise costs, or both.
Okay, thank you, Joanna. Leslie, would you be willing to share your thinking at this point in time?
Sure, I had put my a thumbs up. I'm in agreement with the majority of the group, and I think when I was talking about my comments of the debrief of the public hearing, this is what I was concerned about, the data-informed decision about the cost. And I did not, if I read that criterion, this transaction will benefit. And at this point, I would say no.
Okay. All right. So what I'm just hearing from the seven of you that had an opportunity to share, wait. Five of you are kind of leaning like, don't think so. I'm not saying that this criterion would be met. And two of you are a little bit more unsure, and it may or may not. So that's just kind of a pulse check that I'm observing where we're thinking around this criterion. Before we move on to the next criterion, is there any other observations or thoughts you want to share about cost? Okay. How about if we move on to the next criterion? And this one is the transaction will benefit the public good by increasing access to services in medically underserved areas. Again, what we're asking for you is how well may the proposed transaction meet this criterion, and why or why not? And again, inviting someone who's willing to start us off, and we'll allow everybody to have an opportunity to share. Yes, Joe, thank you so much for kicking us off with this criterion.
Sure, you're welcome. I believe that's their stated goal. They believe that they will be able to do this. I think most of us, I think, have concluded that we don't see a lot of detail around how that's actually going to happen. However, so I guess it's a matter of how much do we trust that if this transaction were approved, would the combined entity be able to move forward and achieve this goal? And I believe that if it's a goal that is stated and focused on and continued to be developed, I believe that they can do it. I guess my question is, will they? Given all of the other unknowns and all of the other financial constraints that will probably arise after, if this goes forward. So not a good clear answer, but I'd like to believe that they would be able to do this.
Okay.
How about that? I'm going to be hopeful.
Yeah, so what I'm hearing is, like you said, that this is their stated goal. Not a lot of details, a lot of unknowns, but you think they could achieve it if they really, continue to focus on it. We just, don't know how that will play out. Thank you, Joe. Yes, Teresa. Oh, Joe, did you want to add something to that I said?
No, that was good. Thank you.
Okay, all right. Teresa?
I'm kind of in the same camp as Joe, that there is a great deal of opportunity here to improve care for medically underserved people. But I don't hear a clearly articulated plan for how that would work. And again, I have concerns about whether the foundation is going to be positioned to do so. I also think that the answers to the question in the public meeting about what OHSU and Legacy have done or will do to remedy past harms to marginalized communities was weak. I was not pleased with the answer that they gave. It seemed that there was one project or maybe even one building that they referred to. I don't remember the name of it right now. And one is nice, but it's really not enough. So I didn't get a strong sense. This is kind of my gestalt. I did not get a strong sense that this was a value and something that a lot of effort would be put into. That's it.
Okay, so again, I'm hearing it's just, that this is their stated goal, but you just didn't see a lot of details of how this will actually move forward. And especially given their response about kind of addressing historical harms, it just makes you a little unsure, it sounds like. Is that, Teresa, fair? All right, Leslie, please.
Thanks, Rhonda. I'm very similar to what Joe and Teresa said. I think the intent is there, but the impact is unclear. I think that what we've seen in the proposal is a lot of service and insight to the Portland metro area, and there's been sprinklings of other areas. And I know Joanna has shared some insight to what's happening in Southern Oregon for those medically underserved areas. But again, I'm not sure, again, it goes back to the data. So I think it's like, if I had to put a percentage on it, I think the intent is there, but I'm not sure on the impact that it will increase access to those who most need it. When you look at that definition of what is a medically underserved area within our state.
All right, Leslie, so what I heard you say, you're very similar to what your colleagues have shared, and you are just not seeing data about how medically underserved areas in our state would be addressed specifically, is what you're calling out.
Yes.
Okay, thanks, Leslie. Okay, Howard or Joanna or Jerry or Wendy, who would like to go next? Thanks, Howard.
Yeah, I agree with what everybody said. I don't think we have a good sense of the specific things that they would do. And I think to some extent the focus on improving healthcare for underserved is related to the foundation. And I kind of second what Teresa said. I think there's a lot of opportunity there. But I think that needs to be, there are some things that need to be addressed. And I would just mention there are several comments about a Family First campaign, I think is what they're called, on ways that those concerns could be addressed in a good way.
Okay. All right. Thank you, Howard. Again, we're hearing kind of a theme. Good intent, unsure about how things would be put in place to really improve access. And also just noticing this connection between the foundation, right? That if this foundation moves forward, potentially that could have some impact. And Howard, thank you for lifting up. There may be some good ideas, right, about conditions in what you're hearing in some of the public comments. So thank you for highlighting that.
And I would just remind us that we've been told that both the foundation transaction and this transaction have to move forward in order for this one to move forward. So they're kind of tied together, at least in the way it's been presented to us. It's both or none.
And thank you, Howard. I just want to clarify, OHA Zachary, is that what Howard said? Is that correct?
That's right. That's how the entities have framed it.
Yeah. Okay, great. Thank you. All right, Wendy, please.
Yeah, so again, I agree with everything everyone has said. I also do have the question still and the concern that if this doesn't happen, do legacy sites that are currently existing, so does that access go down? Even if there's not a possibility. I think it's hard to think that there's a true ability to increase access to services from where they currently are. That's going to be tough given the financial situation we've seen. That costs money. But if this doesn't go through, is there a reduction? So is it an increase over what the other future alternative would be? And that seems like a very real possibility in my mind, that my notes again say, I don't feel like I have the information on that. What if?
Thank you, Wendy. So you're really bringing up a different perspective about, well, first of all, you said you're agreeing with the trend, like it's an intended goal, but the actions for impact is a little unclear. But the point you're breaking is, could access actually go down if the transaction did not go forward, because Legacy may not be able to continue maintaining its sites. Is that correct?
Yes, it's very challenging math that we've seen so far.
Yeah. So thank you for bringing that point up. Appreciate it. Jerry, please.
So medically underserved areas, they talked about it, but the Oregon Health Authority has maps all over the place for HIPSAs and HIMSAs showing where there are the medical shortage areas. And they're talking about they have a hard time recruiting healthcare providers just to take care and to work in their facilities. So I don't know how, they could have addressed that, saying maybe circle some counties or areas around the metro area saying, these are the areas that have medically underserved areas, and this is a plan that we're going to implement to move forward to get that going. You could talk about getting more state or federal dollars for, medical graduates, for student loan payback. So there's not a lot of detail, even sort of like being creative and putting it in writing about what they could do to address the medically underserved areas, but there's not a lot there. So, at least put in a rough outline or a plan that maybe you'd like to do, versus just saying, well, once we get the approval, then we'll put together the plan. So.
Thank you, Jerry. I just want to acknowledge the acronym HPSA stands for Health Professional Shortage Area. Thank you, Lauren. I was going to ask that question. So thank you for putting that into the chat. And Jerry, were you going to make another comment around that?
Oh, no, you get into acronyms or you start doing all that federal speak, it gets kind of confusing.
Great. Well, I just wanted to alert folks that was in the chat. Thank you, Jerry, for sharing your knowledge around medical shortage areas. And so again, what I'm kind of hearing, it sounds like you're similar to your colleagues, that we're hoping for more strategic information and details on how this transaction would really improve access in medically served areas. And you kind of gave some examples of how they could have done that. Great, thanks. Let's see here. Joanna, I believe. Yes, Joanna, please.
Yes. So I guess I would start they did talk about, OHSU did talk about there being more sites for their medical students to do residencies and, get experience at different levels when they were with Legacy, because it would be much easier to send students out to sites that would now be OHSU. They wouldn't be Legacy, they would be part of the same system. So, and they, as I said before, I want to repeat it, but in Klamath Falls, that they are doing that. They are having students coming down and doing the rural residencies. They are bringing medical expertise to an underserved area. And it's made, it's a significant impact in that area. So I think, I would like to think that they would use that. They did say that they would be sending out students to these areas that are currently Legacy that would be under OHSU. So there was a little bit about that. I agree it could be better laid out. I think they're also trying to talk about the foundation piece in that as well, in terms of having more funding for medically underserved areas. And again, I would agree with Wendy on what happens if they don't do this merger, what is going to happen to some of these underserved areas where it's then tends to be they're not making money out there, and it's hard to get people to go. And so are we going to actually lose access if this doesn't go through?
Mhm. Okay. So I'm hearing, Joanna, you're sharing examples of where you see OHSU has been addressing medically underserved areas. And I'm also hearing that, you are concerned about if this transaction does not go forward, what would be the reduction in access if Legacy is unable to?
And they did say somewhere in one of the documents, it talked about them having more sites, more clinical sites, more ability to have students at Legacy, what are currently Legacy areas. So I do think that they did mention that, probably not as clearly as they should have done, or could have done, I should say.
Okay, I just want to open it up again. Yes, Teresa, please share other thoughts.
I'd like to follow up on what Joanna said about training medical residents in other cities, which is great, but I don't believe that the capacity to train students at sites away from OHSU is really that much of a challenge because this is what nursing students do all the time. As a school of nursing, you usually don't have the privilege of being affiliated with OHSU like the School of Nursing where I taught does, but most nursing schools do not have such an affiliation. They're freestanding in a college or university that doesn't have a hospital associated with it. So it's very common to place students at other institutions that are not affiliated directly with you. So I don't see how having a merger is really it removes many barriers to training healthcare professionals. I don't really think it's necessary for that purpose.
Other observations or comments people would like to share around access in medically underserved areas? Joanna, your hand's up?
Oh, sorry.
Yep, no worries.
It's down.
Okay, so a theme, I'm just looking over what I'm hearing folks said, and I think there's a strong theme that a majority of you see that it is a stated goal of the proposed transaction, and many of you are just unsure, concerned, how actually would this happen? Some of you talked about there wasn't data given, there wasn't kind of maps drawn, there wasn't as much fleshing out of how this would happen. So that is, I think, a strong theme that I'm hearing about. Some of you reference the foundation as maybe that could be the arm that would move forward on this, but we know that these two transactions are linked in terms of they both need to go forward. And then the other thing that was brought up is, well, if this transaction does not happen, would access go down because Legacy wouldn't be able to continue to maintain the facilities that it has? Howard, please.
Two things, I guess. One is I think Legacy would have other options, and the state would have some options in ways to support Legacy to keep it going as much as it potentially would need to. And there is some sense, at least, that it's been doing better recently. The second thing I would just wanted to say before I heard that last comment is there are measurements in their measurement grid related to access, and at least they've set some measurement in place. And my comment about that is I think they've given themselves a very long timeline for when they would have benchmarks set, like 18 months, I think, without pulling the grid up. And it seems like they could come to benchmarks more quickly. I mean, the information's out in the world that they could identify benchmark sites and set their goals more quickly than a year and a half from now.
Okay. Thank you, Howard. All right, I'm looking at the clock. We have about 6 minutes. If there's anyone else who would make an observation, I would invite you to do so now. And if not, we'll move to closing. Howard, I assume your hand's up just from the last comment, unless you wanted to make another one. Okay, wow. Melissa, if we can move to slide 29. Thank you. But before I kind of move to next meeting again, just want to thank all of you for your commitment and your really thoughtful responses. You can tell you're doing your homework. You're doing a lot of reading, a lot of synthesizing, also using your own experiences, knowing your community and really sharing that. And I'm hoping you all, are learning from each other and hearing perspectives perhaps that you hadn't thought about before. So in terms of the next meeting, as I already, I think, shared, we'll recap what we've heard at this conversation today. So we will bring back to you kind of some high-level themes that we heard about opportunities, concerns, impact, and what we heard you say around those 2 criteria for cost and access. So we'll bring that back to you so you can look at it, make sure that we captured what the themes were correctly. And then we will continue to discuss the other 3 criteria, like what we did today. That's maybe all we get to. And then if that's the case, then we would go to schedule the March 31st meeting. And that's where we would really kind of do thumbs up, thumbs down across the 5 criteria and move to a recommendation and flesh out if there was any conditions. Okay, so that's where I think we're heading, but we'll huddle with the OHA staff and get a definitive of that soon. Zachary or Lauren, did you want to add anything else to that in terms of how we're thinking and moving forward?
I don't think so. I think you covered it.
Okay. All right. So let's move to the next slide, please. Okay. Again, just reminding folks, this is where you can find information about this transaction in the next meeting. So feel free to go to those places. And then the last slide, please, is just a big thank you. Again, thank you so much. I hope that this conversation today was really helpful for each of you individually. And I would encourage you to think about those other 3 criteria that we have not talked to yet that was on the slide that Zachary shared. That would be around health improvements, around health equity, and around just there would be no hazardous or prejudices against consumers. So you could be kind of foreshadowing your thoughts around those 3 criteria for next Monday. With that said, I wish everyone a joyful rest of your day, and we'll look forward to reconvening on Monday, the 24th.
Thank you.
Thank you.
Thank you.